Good morning. My name is Travis Noto, and I'm a fourth year veterinary student at Mississippi State University College of Veterinary Medicine. This morning, I have the pleasure of interviewing Dr. Jeb Cade, who is an associate clinical professor, mostly teaching in our Community Veterinary Services rotation, but also in our special species lecture in our second year. So, good morning, Dr. Cade.
Good morning, Travis. As Travis said, I'm Dr. Jeb Cade. I'm Associate Clinical Professor with Community Veterinary Services and the Service Chief. I've been here now at MSU CVM for coming up on 8 years here in about a week or so, and just really enjoy it here. How's Arizona, Travis?
It's good. I had a great opportunity to come and do an externship here in an exotic practice, which is a shared interest of both of us. So yeah, it's been well. It's been an experience, and the time difference has been challenging. I'm 2 hours behind, or yeah, behind, so earlier. So yeah,
So you
so
had to get up early this morning.
yeah, that's good though. No worries.
Nothing wrong with that.
So Dr. K, jumping right in, many students are interested in becoming a general practitioner or doing primary care in veterinary medicine. Can you tell us a little bit about CVS and how it help us accomplish those goals, and what are the goals for our students during that rotation?
Absolutely. That's a great question, Travis. CVS really is your opportunity within the Animal Health Center to take part in a general practitioner setting. And so, just like going to your regular veterinarian, throughout the day, we have appointments set up, and we also have drop offs that we see. Within CVS, we also house or have our boarded dermatologist, and we have our dental service, as well as part of our shelter service that students take part in for a portion of the rotation. Currently, CVS is about a 6 week rotation, so really nice amount of time to get there, kind of get your foundation set, and really then start to thrive. Really work on you guys trying to improve communications. Obviously, working with patients. So simple things like physical exam. But it's one of those little nebulous things that a lot of people find difficult. But working on those physical exams, we do surgery, some basic surgeries. Obviously, we talked about dental and dermatologic procedures, but it's a great rotation to get in a lot of the basics that you're going to need if you're going to be a general practitioner.
Sure, and I definitely had that experience. I actually had my rotation over Thanksgiving last year, so I got a little bit of extra time in there as well.
You got that 8 week rotation.
I sure did. And I was actually pleasantly surprised and a little amazed how many dental procedures I got to do and how many dermatological cases I got to see. And I think that really helps you distinguish and build some of those foundations that I didn't expect to feel confident in leaving vet school. I think those are fantastic things. Can you walk us through a typical appointment on CVS, or kind of what the student does, their responsibilities?
Oh, absolutely. That's very easy. Although right now during the pandemic, things are a little different. Kind of like you and I working together right now on video. But right now, so our appointments are all drop offs. However, we still have built in very much the same sort of format we would were the patients and clients in the hospital with us. So right now, what we've got, what we do is we advise every student, the night before to look over their case, try to be prepared for what's coming in. As a doctor on the rotation, and I'm here all the time. Going back and reviewing cases is generally not something I need to do, but as the students rotate through, it's very important that they're up to speed on things. So, get up to speed on their case the night before if it's something that has been made an appointment for. And then what to do is go out. Honestly, right now we're going out to the parking lot. Okay, meeting the owners, asking some very basic history questions. So just a few questions to kind of get us some guidelines for what we're doing with that particular patient. And then from there, what the students will do is come in, complete their physical exam, and then come and find the doctor and present the case to us. And case presentation is one of those things where it's somewhat regimented. We'll start out with a signalment. That's where the student tells the doctor about the patient itself, and then tells us a little bit about why they're here. Whether it's a wellness visit for vaccinations, a heartworm test, and a fecal float. Whether they're here for let's say vomiting and diarrhea. It's a pretty common thing. They may be here for a pre-dental workup. So there's a whole lot of things that we deal with here. They may be here for lameness as well. So student does their physical exam, finds their doctor, presents the case to them, where the doctor does the physical exam as well. And then from there, right now, what we're doing is formulating more questions that we'd like to ask the owner. And one of the wonderful things on CVS that we really work on is communications, and it's become a really a very significant point. I know when I went through veterinary school, communications was kind of like it was up to you, how you wanted to communicate, and it's much more regimented now in a good way. I really like what Dr. Grady's doing with our communication. So we've done our physical exams. We've looked at the patient together. We formulated questions, call the owner. From there, we will let them know what our plan is, what we would like to do, and then just confirm with them that everything is that's okay. And then from there, we'll execute our plan. Again, whether it's us needing to administer vaccines and pull blood for a heartworm test, whether it is making a request for radiology and ordering sedation so we can sedate a patient to do, rads on a knee just because they're lame. So, from there, we kind of execute our plan. And then what we find out diagnostically at that point, we're going to call the owner back, relay that information, and then kind of let them know when they'll be ready for pickup. And then, so during that time, we're trying to make sure we got any medications that we want to send home with the owner, make sure we get those together. And then, so what happens when the owner gets back here, we get a call in the back, and we just mosey on up front, and we present the case, what we found, and our medications to the owner, and what we want as far as a follow-up visit or recheck. Also produce discharge instructions. So really a written detail of the visit itself. We try to send those home with owners when they're leaving, and that's one thing that the pandemic has really allowed for, is us getting those discharges home. However, we also have, if it's a really involved case, it might take us a day to get those discharges together and get them emailed to a patient. But yeah, it's about trying to make a student a doctor to start with, okay? And then what the doctor is there for is really as a backup. And at least on my end, I really I look for students to really kind of formulate their own plan, what they would like to do. And I'm just there to kind of guide. Sometimes our plans are a little overly ambitious, and that's honestly, I like that better than an under ambitious plan. But we'll talk about our plan. Maybe sometimes we'll include some diagnostics that maybe not totally necessary. And I'm just there to kind of say, hey, maybe in this case we want to focus more in this area. And so I've really look to build a rapport with students, and some students are super comfortable getting there and just are outstanding already. Really, you can tell they're not going to have a whole lot of problems transitioning from graduation into practice. And for some students, it's great that they're with us, and we can really kind of massage out some of those things. I know going into vet school for me, most of my clinic experience was cleaning kennels and doing research. And so the hospital part of veterinary medicine for me was a whole new aspect. And so dealing with clients, a whole new aspect. And so for me, it was really is important to get some of that experience. And it really helped me transition once I got out into practice, just knowing what to do, kind of getting the flow of things, and kind of getting a good feel for what was appropriate for what patient.
And I know for me, having CVS during a non-pandemic time, I really enjoyed going into the rooms with the clients. And, when you make that first interaction and you have the dog in the room and the client, and you're trying to get the history, but also pay attention to your patient, walking that fine line and learning that, I guess, art on how do you start putting your hands on the dog while also talking to your client and, making that eye contact. And you alluded to Dr. Grady's communication lectures, which was what my next question I had for you. Most of our vet students or our veterinary school applicants are introverted. The client communication, the I have to talk to an owner. Maybe I'm not feeling confident about all of my drug experience or my physical exams. What during the rotation do we offer to kind of curb those public speaking skills, and how are we building that up in the rotation?
Absolutely. So one of the things that we do, we start every morning out. Students come in and they're going to take care of their patients that are there, maybe take in some early drop-offs, and then we do topic rounds. Some of those topic rounds are communications based. However, Dr. Grady has a whole nother round session during the week that he'll do during lunchtime. And it's very much so there are some different medical communications trainings that are out there. And the one thing that's fantastic is Dr. Grady is sort of certified in multiple medical communications techniques and by different organizations. And so what Dr. Grady's trying to do in regards to communications is, okay, and like you're talking about, introverted people, it can be kind of difficult. And the other thing is you got so many things that are going through your mind. It's sometimes hard to keep focus of what you're trying to ask. And so, rather than turn you into little robots that just go through a litany of questions, had your dog vomited or had diarrhea, has your dog been lame? And some of those questions, let's say they're coming in for an ear infection, some of those questions really mean nothing. And so what Dr. Grady is really working towards is providing techniques to make you more comfortable communicating, making sure you're communicating those points. Okay. So you have, different styles of communication. You can use guideposts. You can do what we call the frisbee. You're asking a question, you're waiting to get the frisbee back there. And so he does a great job of really laying out different techniques that may work better for different individuals. And certainly, I think what his ultimate goal is for you guys to be dynamic in your communication style. So if you're dealing with an introverted owner, what's the best way to do is introvert on introvert? How do you find out anything? Just playing there, but sometimes somebody like myself that's a little more loud and outgoing can make an introverted person feel a little bit more nervous, and so certainly sometimes it's good for me to be dynamic in my approach and not be the same person every time I go in. But what he's really trying to do is give you techniques that you can use based on the different client, different interactions, and so that you're not locked in and just being a little robot. That's kind of the way I see it. It's easy to ask a series of questions. It's much better, however, to ask fewer questions, what we like to say are open-ended questions, and then you can get more pointed as you get more information. So Dr. Grady does an outstanding job doing that. And like I said, when I went through vet school, comms training or communications training was honestly, it's literally non-existent. And it was just kind of, hey, here's your client, go find out what's wrong with the dog. And not to say that there are things wrong with that. It's just what I see today is super, super helpful and would have benefited me in the past. Now, you mentioned, and one of the little things that I'm always working with students on, you mentioned going into a room and being nervous and things like that. But what we've got to do is we've got to look at this from an owner's perspective. And so really the exam room for a veterinarian, a general practitioner, the exam room should be their home. It should be a place where they're exceptionally comfortable. Okay. And so that's one thing that we don't think about. Who's most nervous when they come into the hospital? Well, I can assure you, even nervous students aren't as nervous as the owner who's bringing an animal in for us to look at. And so that space, that exam room, should be our space and some place where we're comfortable. And I think Dr. Grady does a good job of again establishing techniques and different ways to deal with that, so we're comfortable in our space.
Absolutely. And as the nervous owner side, I recently brought in my dog to you, and I probably sent you 100 text messages that day of what's going on, what do we need, can we do this? So it's interesting that you put it that way. But just kind of thinking about my time on Community Veterinary Services, the 6 weeks is fantastic because, well, I had 8 weeks, but in the normal rotation, 6 weeks. Somewhere around that 3 to 4 week mark, the light bulb clicks, and I feel like that for a lot of our students. And we went from like trudging through the day, super nervous, trying to figure out what to do and how to get there, and then by week 6, you're like, I'm going to be in radiology at this time, and then I have this appointment, and here are the drugs I like for this case, Dr. Cade. Do you want to talk about the other case now, or do you want to like wait till later? And to see that transformation in my classmates and myself makes you feel super accomplished. And I think that we do a fantastic job at Mississippi State to prepare our students for that. But it's not a 1 week rotation. It's not like I'm going to cram all this in and practice for 14 days and then disappear into another rotation and never think about this again. I know I use those skills in CVS almost every single day. And even now on the externship that I'm on, being in that room with the client and there's a boarded practitioner in front of you and there's a species I've never seen before, but just recognizing all those cues and how they use the techniques that we've learned in school, really, it makes me feel comfortable in that space, even though it's, I'm kind of in the background trying to soak it up, be quiet and not necessarily get in the way. I understand the dynamics that are going on a lot better. And I think that's important for students in general.
Well, I got to tell you, something as a teacher that I really enjoy seeing as you guys grow over the course of that 6 weeks. And like you say, there generally is a point in time in that rotation where you as students become much more self-sufficient. And we're really there to just, again, it's more like guiding, teaching fine points, and seeing you guys grow. And not just on CVS, just seeing you guys grow as you matriculate through the last 2 years of vet school is one of my favorite things about being here and about being a teacher in a position I never thought I'd be. I don't think I ever set out to be a teacher of veterinary medicine, but I find it to be profoundly rewarding in that regard.
So, I've been looking forward to this interview with you for many reasons. But you're also my senior advisor. And so for everyone out there ending your third year, going into your fourth year, you get to pick a faculty member to be your advisor, and they help you kind of pick what externships you want or electives. And I think that's a super important part in primary care and general practice because, as I mentioned, I'm interested in exotics. And I feel many people assume when you say primary care or general practice, you're thinking solely small animal. So what is things that we provide through maybe CVS or other avenues to help a student like me who's interested in exotics or wants to do a feline only practice or thinking about maybe pursuing a specialty in veterinary practice?
Yeah, no, that's a great question. So here at MSU, we don't technically do tracking like some schools do, where you're like, hey, I want to do horses, and you start out from day one and you're on the horse track. We don't do that here. We're trying to provide and make you guys very well-rounded and prepared, especially for NAVLE, and then prepared for practice as well. So you mentioned CVS specifically. Yeah. Yes, our primary patients are going to be dogs and cats. However, we do have the joy of seeing exotics, or I might see it that way. Some of our other doctors don't want to see that, they don't see the joy in it, but that's okay. But so in addition to dogs and cats, which is the bulk of what we see, we'll see small mammals, anything from guinea pigs, rabbits, chinchillas, ferrets. We have bird patients that come in. The last several birds I've seen, anything from cockatiel to an African gray. Reptiles. Travis has helped us with some of the labs that we do on CVS, where we use reptiles, do some handling demonstrations. And so we have those opportunities to see some non-traditional species. In the past, we've called them pocket pets or exotics. And so we'll have an opportunity to do that. We've also built in some labs so that everybody gets a chance to try to handle a small mammal, a bird, and also some sort of reptile, and so built in those opportunities. The beauty of the 2-and-2 program here at MSU is that fourth year and even your third year, the ability to go out on and do externships, just like you right now being in Arizona at a primarily an exotic practice or a reptile practice. Um, it, it's hard to beat that. It would be very, very difficult to get that experience in the hospital here. But the beauty of it is you get to go do that. So let's say your interest is equine sports medicine. So your fourth year in your third and fourth year in your externship time, you can sit down, try to get in touch with a clinic that does primarily what you're interested in, and then go out and really immerse yourself in a particular field and really maximize your experience, which is super nice. And that goes again for exotics. If you're interested in horses or if you're interested in food animal, all those, you're really only limited by your imagination, maybe finances, and having a place to stay. And so it really is pretty magical. And like you right now, I'm kind of jealous that you're in Arizona at primarily a reptile practice, but seeing other exotics, that sounds like fun. Sounds like some experience I could get out there and really enjoy. But it's the ability here to take your fourth year and really focus on the things you're most interested in is a real, what I find to be a real strength. And so even, Travis mentioned that I'm his mentor. I'm a mentor to about 14 other fourth year students. and guess what? Not all of them are interested in exotics or even a small animal. And that's one of the beautiful things. I might not know where to send a student that is primarily interested in equine sports medicine. But I know who to talk to, and also know that we're going to find those experiences for them. That's not a problem. And so really, it's kind of special. I think it's special in that you guys can really kind of tailor it to what you're most interested in. Yeah.
Absolutely. And then final question for you. You mentioned our shelter medicine department.
Yeah.
And my experience in that department is we get a ton of spay and neuter experience. Do you want to touch on kind of what that shelter week during CVM is like?
Absolutely. So we had a little slowdown during the pandemic, and we are actually this week, today, we're starting our shelter week back up with students. So in that 6 weeks CVS rotation, one of the weeks we have what's called shelter week. So you do 1 week of shelter medicine, and you'll do 1 week of dermatology, but we're focusing on shelter medicine now. So 1 week on shelter medicine, you're going to take time, go into some local clinics here, spend a large amount of time doing physical exams on these patients and trying to get them in the best position to be adopted. The other thing that you're going to do on that is you're going to spend a day or two doing surgeries, lots of surgeries. Again, in Mississippi in particular, and I think this goes all over the country, but a pet that's been spayed or neutered that's at a shelter has a much higher chance of being adopted than one that has not. And so you guys go out into the community and help these shelters out, not only doing physical exams and identifying things that need to be treated in these shelter pets, but also doing spays and neuters, vast numbers of spays and neuters, way more than I did as a student. I find that is one of those things that I think is super, super helpful. I know, I've talked to some colleagues that graduated from different places, and when they graduated, they maybe done half a spay. And here you're going to leave having done fairly large numbers of spays and or neuters, anywhere from 30. I've heard people doing 100 before they graduate. And so there is that opportunity to, you mentioned earlier, being comfortable in exam room and being comfortable communicating with clients. And I think knowing how much surgery goes into in at private practice, having been in private practice for about 7.5 years, being comfortable doing surgery is critically important because it's going to be something in general practice that you're probably going to do every day. And so, like you mentioned, I've never had a problem talking to people. But I lack some confidence in my own surgical skills. And so getting to do that vast number of surgeries certainly would have been helpful for me. However, I got to do probably 15 surgeries before I graduated, and then I really never needed help in the OR. I can think of a couple of times where I needed a little help with the surgery, but I got really comfortable, and it's that experiential learning, doing more and more, and getting comfortable with it, so that when you're out and on your own, um, you know, your boss is not worried about what you're doing in the OR.
Yeah. Fair, fair. I think I've done 17 so far, and we'll call this the beginning of my fourth year, and I still have another shelter rotation to go. So
Oh yeah.
I think they expect us, or at least before the pandemic, 45 to 60-ish during that week as well.
I think you're going to be back on track there. So you're going to have a high volume there.
Appreciate it. Well,
Yeah.
Dr. Cade, thank you for your time. Do you have anything else to add that maybe I didn't cover that is important to share with our viewers here?
Well, I think the just sort of some rounding, ending things up points here. CVS is just a part of your education here at MSU CVM. I do think it's very integral, as it's a place where you're going to really focus on doing those physical exams. You're going to focus on learning to draw blood, what colored tubes to put the blood in, how to read blood work, intradermal skin testing, dentals, tooth removals, minor surgery. Like, we do so much. It's really hard to just in a 30-minute video try to convey everything we do in CVS. And really, the other thing about MSU CVM that kind of sets you apart, I really feel like there's a family atmosphere here, and it's one of the things that I really, that keeps me here. Seeing you guys grow as like you're my own kids, and just watching you flourish. Again, it's the reason that I stay here. Is I really enjoy seeing you guys grow, and honestly, there have been a fair number of you guys in the last 7 years. When you've graduated, y'all are already better doctors than I am, and that's something that I find, totally satisfying. And some people might be intimidated by that. I'm like, no, it's what makes me get up in the morning and come to work.
Well, thank you so much. I appreciate all of your mentorship. Have a wonderful day down in the clinic, and keep on teaching.